you guys. Thank you so much for coming in today. We are honored to be with you amongst other military families. And we hope that through our stories and some of our challenges and things that we have faced, that we could help educate you guys and provide a smoother path for you all because we don't want you guys to have to walk in the same and be in the same trenches that we are in. The difficulties that we have faced. I know more of mine have been once my husband got out of the military, which is when we learned that our two youngest ones were on the spectrum and navigating that in because it's just totally two different worlds being active duty versus non. But hopefully, through this, we'll be able to help you. And we look forward to speaking with you guys later on.
Carmen, I definitely agree with you on that. A lot of military families, they face challenges. When they are active duty, one of the services that they do have is the Exceptional Family Members Program, which is the EFMP. That is a big program through all branches where families can enroll. You have your child that is diagnosed with autism, and they help you navigate and hope for a smoother transition. And as you said, during your active duty time, that EFMP, which is the acronym, it helps you to even speak to case managers, get services. And so when you leave the service, unfortunately, one thing that happens is that service goes away. And so you are left to search, navigate, look for anything you can to help your child. And one of the things that most important mindfulness is that it's making sure that you do not overwhelm yourself as a parent and caregiver. Overwhelming yourself as a parent and caregiver will reduce what you can offer for your child. So sometimes when you have that transition, this service member may get a short amount of time to transition to civilian life. The dependents and the caregiver and spouse, well, they do not have that time. It is from active duty status to veteran status, and it is to a world that now you have to try and navigate through the waters while also caring for your child with autism.
I would say about the overwhelmingness, like, organization. I know that you and I have talked before about organization and just, I have three different kiddos on the spectrum. I mean, and different ages, different ranges on the spectrum. And so it's just staying organized because I can't tell you how many times I've shown up to the wrong appointment with the wrong kid, because I got my days and appointments mixed up, it's just giving yourself grace with that. But organization is the key because, like you said, when you are in that program, you do have a case manager. And then we did not take part in that program. And then that's something that I wish that we had known about when we were in. But not having a case manager, especially when you're out and new to the diagnosis, is very overwhelming. But organization, and if you can lean on someone, that definitely helps as well too.
That brings me to in every branch you have and bases, you actually have a school liaison. So while you have your case manager through the EFMP program, you do have access to a school liaison. And that school liaison, even when you leave the military, as a retired family for us, we actually relocated in a retired status. But that school liaison person that was serviced through the military base, they were able to help even get us started, even in a new
Mhm.
environment, to get enrolled with a case manager, to get all services started. And a lot of families just do not know about that small detail. And that school liaison also help with navigating through the public school system. And that's one of the most important things to have, is someone to help bridge between going from one status to the other, from one location to the other. And so a school liaison is, they are there to help you. They are there to help foster what you left from and what you have come into. So I would say everything works together. If you're able to get all of the moving parts working together, having a school liaison with your case manager. And I will say for parents that and caregivers that do not have that, it can lead them into becoming overwhelmed because they're trying to find everything in this new civilianized world. But active duty, when you're active duty and you go from one duty station to the other, most times it's like when you are leaving a duty station, you are given a certain amount of information on who to contact when you first get to
Hmm.
your duty station. And with that, that helps you. And so when you don't have that, it's school liaison, case manager. We look for our pediatrician. When we know we're going to a new location, we are looking for that new pediatrician. Well, between the pediatrician, the case manager, and the school liaison, those would be the three top people that you want to have on your to-do list when you are trying to establish to a new location.
Absolutely. Just knowing having that transition, just someone to sit beside me and say, it's going to be okay. You're going to be all right. Because I remember I had all these papers and stacks and just like, what do we do here? I need to get this started. But yeah, she was absolutely amazing.
With even that transition, one thing that a lot of families may experience is the loss of TRICARE. TRICARE is the military insurance that active duty members and their families have. It covers therapies through the EFMP program. It covers all of the therapies, your speech, your OT, if you have physical therapy, cognitive behavior therapy. So one of the things that can be really challenging is when a service member leaves the service, but they're not retired and they lose their TRICARE benefits. That is a major loss because that family is still left with starting over, trying to find a new coverage of insurance for their child
Mhm.
and hoping that it is not a months of a gap long. Prior to moving, that is one of the things that through your case management, they can assist you. They can assist you with even having the resources before you get to your new location of where you guys are settling down. And this is for your people separating from the military, is having that list of the people to contact. Again, the school liaison, they still should help navigate because you are a new member, you are newly leaving the service. So when you leave the service, it may feel like you are just like cut off completely, but still reach out to your military contacts. If you're near military base, especially if you're near military base, reach out to that school liaison, reach out to a case manager because the information they may provide to you, while it may not be in a direct relation to your TRICARE benefits because you have lost them, they should be able to provide you with some context that you will need to help with that transition with your child or your dependent with autism.
Say they're not near a military base. What is something else, or who else could they contact if they weren't near one?
Even somewhere where you're not around a military base, if you have TRICARE, you are actually you're in a good way. You're in a good way because that TRICARE follows you. So all of the services, you just have to basically find providers. But if you're having to change to a civilian insurance or to a Medicaid or Medicare program, it is most times you are going to have to do a switch that sometimes can feel drastic. Unfortunately, because it feel very drastic, like you're starting all over. But you don't want to see it as starting over because everything of what you did before the move, whether you were limited in being given information, when you look for and you research, we know that autism parents can be some of the best researchers, and you
Yes.
can research and find an astronomical amount of information. And so when you leave that AGR slot, because you technically were in a reserve status, is to look for where you are going. When we move from one place to the other, if we move from one state to the other, even without a child with autism, you are researching what is there, what is available. You are looking, as I mentioned before, you're looking for that pediatrician, you're looking for the therapist. And with social media, there's access out there where you have pages and groups that you can reach out to. There are a lot of social media groups for military families in the EFMP program. A lot of them become more private groups because they are that active duty status. And then there are some groups that do allow members that have left the service or retired to still join basically a community, because that is what you're looking for, is for that community to help. We do want someone to hold our hand, because the life we knew as an active duty service family or as an AGR family is, we need that hand holding, and it's okay to feel that. It is okay to, again, reach out to anyone. You can contact the nearest military base and say, hey, we just left AGR status, we just left active duty status, and I am lost. Can you please help me? And most times it's like, if they can help you, they will provide you with what is there locally, because you can move to a location that is more than 50 or 100 miles and there is no military around. But that does not mean that they cannot help you with trying to get you connected to someone where you are locally. And that will actually help even as you navigate. And school is one of the issues, as we want to definitely have a discussion, because when you have that IEP, and you know that you're leaving that state or wherever you were, most times it's from state to state, you have that IEP written for your child. And it is a federal document. It is gold. And it is the golden ticket for when you go to your new location. And that IEP, you want to make sure that you reach out to someone who is, one, somewhat knowledgeable in the military transfers or the military separation field. And that, again, can be someone through the EFMP program or through the case management at a military hospital, even if they are miles away from you, to contact them, because what you are about to embark on is more changes, because that IEP from the previous state, it no longer is exactly what you will receive in your new state. There will be changes that will happen very, very fast. Within 30 days, they are trying to change things. And so having that support as a military service member, and a military service member or affiliate, meaning a veteran, a retired person, even if you go from active duty to reserve status, is that you are still a military affiliated family. And that is what you want to really foster when you contact them and say, one of the first thing is, we just left AGR status. Can you please help us navigate the school system? Can you please help us with any resources that you have? And I think when you do that, it's what you can do to help other parents is just share your knowledge about that. Your experience is that leaving AGR status and you get to your new location and you're like, whoa, it's like, and you have to try to figure out how to navigate. This is a day and time where we can contact people through social media. We can find people that are, say, located where you are moving to. And even if it's find a community of other parents that may be military affiliated, 9 times out of 10, you will find someone. You will find that one parent that say, oh, yes, we're a retired family, or we left the military. Let me show you what I know or what we have learned. And so I will say, just moving forward at any time is, even if you plan on leaving in, say, 5 years, you want to move to another state, you will have experienced that move from that active guard reserve status to civilian service, but you still technically are military affiliated. So one thing that military families, they feel that they are just cut off, or they no longer have. And I will say that is not true, because as a military family, while we did relocate to a big military city, is that one of the things is you still can feel like, oh, well, we're retired status. That is not for us, but that could be far from the truth. And one of the things that parents need to know and understand is, it is okay to ask. They may tell you, no, I can't help you, but at least you tried.
Absolutely, because if we don't ask, the answer will always be no. That's what I found. It's just, and then again, like you said, you never know who you may come in contact with just by starting up a conversation. But would you say that was when you were moving? Because I mean, I know I purposely delayed a year moving with my husband because I was so nervous about moving. I mean, I literally cried probably like almost every day because I didn't want to go. I'm like, this is safe. We're in a good place. Let's just stay here. You go, and that's not sustainable. But would you say that was the moving part would be your biggest challenge that you faced, or what would be one of the biggest challenges that you feel that you faced?
We were active duty when I decided my son was diagnosed with autism. And one of the things in the 2000s is we didn't have the digital era. We did not have things at our fingertips. So leaving an active duty status, well, first of all, we actually left before he formally retired. He stayed behind for almost a year because we wanted to move to a location that had the services. We were an hour from an Air Force base, which did offer support with us as an active duty family being away from our active duty service member. So while we were able to prepare, because where we were with the diagnosis, it was somewhat of a remote location. That remote location actually gave us everything and it was overwhelming. But it was not because we could not find the most appropriate services for my son. So going to a location before the actual retirement, it helped because it's, even though you're talking 2006, 2005, there was just not enough in the digital world. We were still in dial-up. And so trying
Mhm.
to locate, but fortunately we had the news, you had TV, and we searched for autism. What city has autism supports? So the city we decided to go to, and Ohio State is one of, you're talking for a number of reasons. They are an exceptional school, and everything around Central Ohio, you can find it if it related to autism. So while we were still an active duty family, we were able to move there and have our TRICARE still as an active duty family. But the part that really was the shock is that once the retired status came, is certain things that were not covered by TRICARE. So TRICARE being that insurance, we still had TRICARE Prime, which is you can select between TRICARE Prime, TRICARE Select, and TRICARE Standard. Each one, similar to insurances, you have certain benefits.
Mhm.
Through TRICARE Standard, you can select your own providers. But with TRICARE Prime, you have in-network and out-of-network providers. One of the fortunate things that we had is we still had that TRICARE. But as a retired military in 2007, TRICARE did not cover ABA. TRICARE covers speech and OT only. So with a family that knew that, okay, this is a therapy we heard, can work. So families actually gathered together across the country and traveled to Congress to fight for that one benefit for retired family. As a 38-year-old retired service member, you should still have somewhat of the same benefits as you did active duty. So that was one of our challenges that we faced with just trying to get the services, because fortunately we were active duty. And then when we went to the TRICARE Prime, we were able to keep the same providers. And so a lot of families, though, are not as fortunate. And when they're not as fortunate with that is through whatever your insurance have, through pediatricians, through hospitals, if you are receiving services, you should be able to reach out to someone. Case managers tend to come to mind is that you have case managers at hospitals. If you have a pediatrician, they should be able to get you in touch with someone to help you to even be able to say that it's like, okay, I am moving before my spouse is moving, because we need to find a place to get stabilized. And especially when you're dealing with from medical to educational, you want to make sure that you are not skipping any beats, and that if you do, you still have someone to reach out to. So just being able to be prepared, sometimes you can never be overly prepared, but you don't want to overwhelm yourself, because what happens is when you overwhelm yourself, that child that we are caregiving for, they actually can feel, they can sense that. So a lot of times just having a mindfulness about being overwhelmed about doing everything, because we want to do everything from A to Z. And your
Hmm.
child can be 3 years old, but you don't need to know about guardianship when they're 18, but you want to. So just picking and choosing and being very careful and strategic to make sure that, okay, I want to plan out. It's similar to their milestones. When we have our kids, we go to the pediatrician and they have their milestones. This is where they are, this is where they're going. And you like to see that. And I use the same principle. And I say my son is 20, so I use the same principle for even all these years later, that it's like, okay, we are in the next phase of his life of autism. And so being that military family, it never leaves you. The organizational skills as a military spouse, as an active duty person, it's like it never leaves you. And so you take that with you, so that when you do get to your new place, what you're seeing is that I am building. You are building on the knowledge and the experience that you have, because you may not know everything when you get to your new place. But after a year, you will see that it's like, oh, okay, here's a military family that I know just relocated here. Let me hold their hand. Just
Yes.
like you said, let me hold their hand and help them, just navigate through the systems, because it can be difficult. We all know that it can be difficult raising a child with autism. And so what we do is, when they say it takes a village, and for with military families, when you meet other military families, they become your family. And that is one thing to hold on to. And I personally like to search and look for military families to see, what do you need help with? I may not know, but I will help you find it. And that is just one thing that, as military families, is to remember. We, no matter what branch you are in, is that every military affiliate person, our family member or ourselves, we served. And what we served is we served. And having a child with autism doesn't mean that you're different. It means that you have a bigger family than you actually
Hmm.
thought you had in supporting that journey of autism.
That is so true. And I think that's very important for us to remember. And I think that's why it's so important for the groups, especially now in this age, the support groups that are available digitally. And I think that we need to also not isolate ourselves and actually ask for help. I know that I am forever grateful for meeting you, Carla. I was able to formulate an even better plan than what I already had. How can we help our families with that? Because I mean, we have our checklist that we have to do, but what else is something more that we could do?
I will say, as a dual military, which I was dual military when I was pregnant with my son, and I left the military because autism wasn't in the picture, but raising a family in the military we felt it would be a little bit difficult. And so one of the things that, when you say that, how do you help families, is deployments are hard on anyone, especially for the caregivers. So when I see a spouse and of an active duty or a service member, and she said, oh, well, I'm just the spouse, and I thank them for their service. So we thank active duty military, we thank veterans for their service, because it's the honorable thing to do. But one thing we don't think about is, we don't think about the spouse, we don't think about the children. So when I thank even the spouse, I'll thank the children for their service, because they did serve. So that deployment, when you have a deployment, it becomes one of the things where you build your community. You always stay in touch with your case manager. You always want to know, okay, is there anything new? That is one of the big things, is always ask your case manager, is there any new treatments? Is there any new therapies that I may be able to use for my child with autism? And surprisingly, is there's always something new for you. And so being able to just support that. So a lot of virtual support groups are out there. And one of the things is, while it may be virtual, it's, when you find the right one and you find the right people, so just trying to make sure that they're not alone. Because as you mentioned, isolation. Isolation comes with the territory of a military family. Because if you're a military family, it's like you are actually in a world of your own anyway. So one of the things is to get out of that isolation is always have one or two. One or two. You do not need to have a big giant group, but having that one or two that you can really go to, that you can talk to, because support groups it could not just be for you. You can share your story and you can help someone else. So through your experience, through your difficulties and challenges as a military family, you will be surprised at how many in a room of people that it will help, because you may think that it's not helping and that it's helping you to tell your story. And that's when you find your people, you find your people that basically say, oh yeah, well, you mentioned this in your story, did you know about this, or did you know about that? So always just making sure that, because if for the caregiver, and I said earlier, if you don't have support, you cannot provide that care to your child. And that is very, very important. It's very key to have, some type of mental health support is what I like to use it as, because mental health support is, we all need it to basically be able to just help us navigate just through the world. Even without autism, we need to have it to help navigate through difficult times, frustrations, insurance not wanting to cover this or insurance not wanting to cover that. So you see that your child may wait 6 months, or I have to get a new provider, but just making sure that you're there with them, with a family, especially our newly diagnosed families. Newly diagnosed families, they can see you as a veteran of autism. That is,
Mm.
they can see you that, oh, well, your child is older, your child. And it's like, so our newly diagnosed families, they struggle even with the military. They leave the military service, and so they don't have that support. And so they are out there trying to navigate a new diagnosis as a former military family, and that can be even more lost. They can feel that they are lost in the woods, as some military like to call it, when you're trying to navigate yourself with grid coordinates to find your way back to the home base. And so just trying to, and that's a good analogy, using a home base, having a home base of support. And that includes your case manager, your school liaison, anyone that you can find. And because those deployments can be extremely difficult on the caregiver, and it can be extremely difficult on the children, especially those with autism, because that parent is no longer there. So that's where, with military families, look for support groups. You may be out of the military, out of the AGR status, but look for military support groups. You would be surprised at how many are veterans, and they are trying to navigate. They may have served 2 or 3 years and they left the military, but it's 5 years later and I have a child diagnosed with autism. And so they still have that military connection, because one of the things is, like I said, we are all family, and we are all basically traveling this journey of autism together. And when it comes to that military part, that is just an extra that's added to some of the difficult challenges that we may face. But I like to say that, use that to your advantage. Use it to your advantage to see, create play dates, create play groups. There's so much out here in the digital world that we can look for, we can find. But if you know someone, especially again, as your newly diagnosed families, take their hand. Because I know, Carmen, you said that, yes, you're so glad. I am so thankful we met as well, because as a veteran myself, as a mom of a child with autism, I know of the challenges of being in a new place and trying to figure out what do I do? Where do I go? And so I just give that hand. Now that I've learned, you give that hand to someone and say, okay, what is it that you need help? What are you looking for? Because while we are traveling our own journey, we also know that it's like what we have learned most likely will help the next person.